From helping to treat bones that are broken to detecting cancer, X-ray technicians have a big responsibility in the health arena. Good evening and thanks for joining us tonight. When you walk into the hospital, the people taking care of you know what to do.
There's some concern about the skill level for those who perform X-rays. And a North Dakota legislative bill making its way through the House may in part be creating those concerns. Valley News Team's Krista Boehm is here to explain the bill and examines those who could be treating you or your family. Krista?
Right now, X-ray technicians are only considered certified after they pass a national exam. A nurse, however, would be considered licensed once they become nurses. The bill being considered in Bismarck would allow X-ray techs to be considered licensed and could do more, especially in an emergency situation. They would join limited operators who also can perform X-rays. However, that's raising a red flag regarding qualifications.
Welcome, come on in.
Walking into warning signs. It can be a bit intimidating.
I have children, so my main concern would be for their safety.
Generally, when you get an X-ray, it's from a qualified X-ray technician. Erin Hetland was an X-ray technician for 9 years.
I went to school to NDSU for 4 years, and then I interned at Merit Care for 2 years. And so it takes a lot of schooling to understand the principles of X-ray.
A skill she says she still hasn't mastered, which is why a piece of a bill in North Dakota concerns her.
I shouldn't have to ask, are you qualified to be taking my X-rays?
She supports X-ray techs being licensed to perform more aspects of the X-ray process, but has concerns about limited operators, people working side by side with X-ray techs, but not as qualified.
Like a lab tech or an LPN who just cross-trained into X-ray, like they kind of follow an X-ray tech around for a few days and then they consider them.
Annabelle Pfeiffer, who manages Sanford's radiology department, says that's been the case since 2003.
There are people that are trained to do just very minute X-rays, very low-risk X-rays in the rural communities, and they do have minimum training requirements.
The bill would allow the limited operators to need some kind of medical background, but not specifically in radiology. And when it comes to having enough training to provide quality X-rays, Hetland says that's not enough.
The quality of an image is only as good as the person taking the X-ray. Things can be missed. A diagnosis could be missed.
Limited operators can be anyone from a nurse to a lab technician. They do not have to pass the same kind of national exam an X-ray technician has to. This bill would not allow them to do more if asked by others. Mike?
All right, Krista, this bill has already passed the state Senate and will be looked at by the House next week.